Okay, welcome to the start of the skeleton lecture. I wanted to give you guys a quick look at the skeleton in life because you're going to see a lot of schematics and a lot of slides of the skeleton, and nothing actually beats seeing one and touching one in real life. And because you're at home, you don't have a chance to come up and see this on break. So I wanted to give you a tour and point out all the relevant features and shapes on this before we get into the slide presentation. So first I'm going to take off the head because we don't need this. I'll throw this off to the side. We're going to start at the base of the neck, the pit of the neck, at the clavicles. So we have clavicles on either side, and the joint of articulation for the clavicles is right at the center point on either side of the sternum. All right, so right there and right there. I want you guys to appreciate, before we move any further, how far apart these actually are, because a lot of people make the mistake of putting a very sharp V notch at the base of the neck. And there's actually probably about a 2-finger width between the clavicles. So appreciate that. And now we're going to work our way out, and then we'll come back to the rib cage. So working our way out the clavicles, I want you guys to know that they're not straight. They're not a straight bar. They actually have a very nice curve to them, a little bit of an elongated S shape. I'm going to tip this forward, and hopefully you can see for yourselves a little bit of the S shape that I'm talking about. So out at the front, and then a little tail, and a curve back at the outer edge. Okay, this is actually important for a number of things. It's important for the way the plane's set up on the body, if you're looking at the body in 3/4, if you're looking at it straight on. Another way to think about it is if your clavicle was a straight bar and you did this, you have a lot of mobility in your shoulders. If you pulled your shoulders all the way back and your clavicle wasn't rounded, then it would be impinging on your throat and your arteries and your veins, and you would quickly pass out. So evolution has been very nice to us and given us a nice round shape to accommodate our neck when we have this kind of mobility in our shoulders. Okay, so at the outer edge, we have a fibrous joint. Not kind of an articulation joint, but a fibrous joint that has a bit of movement in it. But it's the joint between the clavicle and the start of the scapula, working its way around the back. And this is a critical bony landmark for us. It's a landmark called the acromion process, right? And you can feel it for yourself. It's the point of the shoulder, right? It's a big kind of rectangular bony plate that no matter how developed you are, whether you're muscular or thin, you're always going to find this exposed on the surface. So for that reason, it's very important that we establish it on our models or our drawings and use it as a reference point. So hopefully you can make out the shape of this a little bit, kind of an elongated rectangle on its inner border. It joins with the clavicle. Okay, if I spin around, you can start to see how the acromion joins into what's called the spine of the scapula, which is another beautiful landmark that's going to really help us to resolve a lot of the complexity of the upper back. So, spine of the scapula, notice that it's not a horizontal line, it's kind of a descending angle down. And when it gets to the inside, the medial border, it starts to descend down. And this is going to be another landmark for us. So, it's called the medial border of the scapula. And these two angles are going to be very important for us to establish the flow of muscles to the outside, the flow of muscles to the inside. So we'll always find these, and they're good surface landmarks to locate. Okay, and I think that's all I'm going to say about the scapula for now. We'll see more important details on that as we get into the musculature. Okay, back to the front. Now, for the sternum. Sternum is actually composed of 2 bones, a bone called the manubrium and a bone called the sternum. In youth, there's kind of a flexible joint between the two at the level of the second rib right here. And as you get older, it fuses. And it fuses to something that's not a perfectly straight angle. So there's a little bit of a plane change in profile between the angle of the manubrium and the angle of the sternum. So the manubrium descends at a more oblique angle as it comes backwards. Okay, and just keep in mind what I've mentioned about this being a joint in in our youth, because that has implications for how the shapes of the pectoral muscles lie in this area. Okay, sternum proper is down here, and then we have a little tailbone called the xiphoid process, which we'll ignore for the most part because you don't really see it on the surface and it doesn't do much. Occasionally you'll see it when somebody's bent back and will poke a little point out at the top of the abdomen, but mostly you don't see it because it's a level recessed, kind of off the underside of the sternum. Okay, so we'll talk about ribs next. Ribs, there's 12 ribs. 10 ribs that connect into the sternum and 2 floating ribs around the back. And if I go around the back, you can see the 2 floating ribs. And it's true that men and women actually have the same number of ribs. Somebody asked that once in a lecture, and everybody has the same number of ribs, 12. So despite what the Bible says or any kind of biblical references, the same number. Okay, so the first 5 of these are true ribs, and the next, 1, 2, 3, 4, 5. So 5 and then up to 10, 11 and 12 are the floating ribs. So 5 true ribs, 5 false ribs. And you'll notice that the bone of the ribs actually only comes around to here. You see a line where this changes into kind of clear plastic on this skeleton. But this actually represents what's called costal cartilage, which is kind of a flexible cartilage which joins the rib cage into the sternum. And that's actually the reason that you give somebody CPR without breaking their rib cage, because this is actually flexible. It's quite tough and rigid, but it is flexible. So if you did see somebody dead lying in the grave for a long time, all this would have decayed, the costal cartilage, and the bones would still be there. It would look like a little cage with fingers sticking up, and the sternum fall into the back of the rib cage. Most of this is covered by chest muscles. See little nodules where the costal cartilage connects on thin people, but for the most part, up 1 through 5 are covered. So what's important for us to know about the skeleton and the rib cage in the front is the shape and the angle of the costal cartilage for the false ribs as it connects into the sternum. So you can see all these things kind of merge into a common mass of costal cartilage. And this becomes very kind of irregular and rounded. And so it protrudes out, and you see it often on the model if they're stretched out. You know, if they stretch back, you can see costal cartilage pushing into the skin. If they're flexed, there's muscles that transpose over top. So this area becomes quite variable. Sometimes you see it, and sometimes you don't. So we really have to investigate that and look for good reference to really resolve this well in our models. Okay, so we'll keep that in mind, and we'll see images of costal cartilage. The way this joins in, this is called the thoracic arch, and this is one of the distinguishing characteristics between men and women. On men, the angle of the opening of the thorax of the rib cage is about 90 degrees on end. On women, it's much thinner. It's about 60 degrees. So you can imagine this being down another 15 degrees on both sides, and that would give you more or less the opening for a woman's rib cage. Okay, so now going back around to the posterior view, we'll talk about vertebrae, right? And there are 24 vertebrae in total. You don't really need to know the number, although it does come in useful. But I would like to tell you that it's broken into 3 sections. You have the neck section called the cervical vertebrae. You have the middle section called the thoracic vertebrae, and the bottom section called the lumbar vertebrae. Of cervical vertebrae, there are 7. And 7 is important to us because there is a critical landmark at the base of the very last cervical vertebra. So 1 is the first, the bottom is the 7th. And this is the first one that you feel. And you can feel in the back of your neck the 7th cervical vertebra. And critical bony landmark for us, because there's a lot of tendon, there's a lot of things that happen around that area that we need to know that make surface form on the upper back. So most of these are internal, and then below you start to be able to resolve the spines of the vertebrae sticking out. So of these 7, only the last one, the 7th, is visible on the surface, and you feel it for yourself. below that, you can actually start to feel all of these depending on how the body is oriented. Okay, and so for the rib cage, there's actually 12 vertebrae, the thoracic vertebrae, one for each rib, as you may or may not expect. So a pair of ribs going around either side for each vertebra going down the thorax. And down at the base, they start to become a little bit more sturdy and a little bit thicker. And when the bottom thoracic vertebrae transitions into the first lumbar vertebrae, these start to get really big and the spines start to get really chunky. Because you can imagine they have to bear the weight of the entire upper body. So the lumbar vertebrae are very robust. Down through 5, you can actually feel these little bony spines on your back, and you see them, and you can indicate them in your models if some of these flex forward. That's when you start to see these. Okay, at the very base, we start to get into the pelvis. And in the pelvis, the vertebrae mate with a bone called the sacrum, which is one of the pelvic bones. Okay, and the sacrum is actually a big, massive fused vertebrae. And then at the very base, you have caudal bones, which is our coccyx bone, which is our tail, our fused kind of evolutionary tail. So this is a big mass that's a very nice, gnarly surface for muscles to grab onto, and we'll see how the spinal erectors grab onto this bone, the sacrum, in a little while when we get to the upper and lower back lecture. Okay, so moving out from the sacrum, we start to see a very important bone of the pelvis, and this is called the ilium. And this is the guy. It's a big wing-shaped bone, and it has a number of nice landmarks for us. One, the actual shape of the crest of the bone itself is an important landmark. I'll pull the arm back so you can see. An important landmark going here, half covered with oblique and fat in the back, but half exposed in the front. At the very front, when we work our way around to the front of the skeleton, you see two really important landmarks, and it's called the anterior superior iliac spines. And you may not like the name, and you may hate it to start with because it's a mouthful, but it's very descriptive. And all the names in anatomy are very descriptive, so we have to learn their actual names because, one, we speak a common language amongst ourselves, so I can always refer to this as the anterior superior iliac spine as opposed to that bump on the front of the hip or something that doesn't make sense that you might call it to me. And two, if you know the names, it often describes a bit about the orientation or the function. In this case, anterior means the front aspect. Superior means above, oriented above. Anterior superior iliac is the adjective for ilium, the bone that we're looking at. And spine is a bony protrusion in anatomical terms. So each of those helps to describe the location and the bone that this landmark rests on. And it becomes critical for us to help place leg muscles and kind of abdominal muscles a little bit later. It may not be a mystery to you, but a lot of these have pairs. Whenever you have an adjective in the name, there's typically the opposite somewhere on the skeleton. So we talked about anterior superior right here. If we turn this around, we have in the back two landmarks called the posterior superior iliac spines. So you can imagine that, I think everybody's probably familiar with these. These are little dimples that occur in the back of the pelvis, right above the butt. So landmark, posterior superior iliac spines. Okay, let's put this guy around. Okay, so we've talked about the ilium. Two more bones in the pelvis that we should be aware of. Not so much exposed on the surface, but actually give us nice reference points. Pubic bone is right in the center, and this comes down to a joint in the middle. Each lateral half joins the middle at a point called the pubic symphysis. And this is right at the base of your abdomen. And this actually represents the center point on most people's body. If you divide the body from pubic symphysis to the top of the head and the same distance to the bottom of the feet, which is great to know because that's a really quick way to divide your model and check proportions above and below. Okay, so pubic bone not exposed on the surface, but gives us nice landmark because, again, we have the center point of the body, the rectus abdominis goes in there, but also there is a ligament that goes from the anterior superior iliac spine to the pubic symphysis and helps to divide the wall of the upper body from the legs below. Okay, and then finally, if I rotate around the back, you have the sitting points, your two sitting bones called the ischium. And these are the big kind of tuberosities or big protruding bones of the pelvis that you sit on and bear weight. And there's also a lot of muscles that attach into here. So you can imagine all your hamstring muscles grab onto here, all your adductor muscles, muscles that pull your legs into the middle, attach on here and help to articulate the hips and the knees. Okay, that's all I'm going to say right now for the pelvis. The last thing I wanted to mention, and we'll talk about the legs in a separate lecture as we get closer to the lecture on the muscles of the legs, because I don't want to cover too much in detail because it's a lot of information and we'll have to revisit it anyways in about 4 weeks. So I'll just introduce this guy because we'll see him on the surface in a lot of our slides. Greater trochanter, which is kind of one of the landmarks on the hips that we'll see a lot. And this is kind of a big bony protrusion that sits in the middle of the pelvis. So you have all the gluteal muscles shaping around, sitting in the iliac crest, in the ilium, and they're all grabbing on around the greater trochanter of the femur. And they help to articulate the hip at this point, right here. So this big bone. It's the femur. This is our landmark on the surface, and the rest more or less is encased in muscle. So just remember that's there. We'll see it a lot. And we'll revisit it again when we start to talk about the legs. Okay, the last thing I want to talk about while we're on the upper body is the arm and how it mates with the shoulder and then some of the complexity of the forearm. So what we have is a ball and socket joint at the shoulder, and the socket is actually made up of the clavicle and the scapula together. But primarily the scapula has the mating joint for the humerus. And you have a nice round cavity, but then protruding in front, what you have is a little finger, and it's called the coracoid process. I think you can see it here. If not, look at some of the close-up pictures in the reference slides. And together it just forms a little socket with a bunch of protruding bones that have ligaments that wrap around the ball of the humerus. And it's not critically important to us, but this little finger is actually pretty important because although it's kind of generally buried underneath deltoid muscles, at the outer end of the clavicle, if you see somebody bend their arm back or if they're very slightly developed, you can see this little finger protruding into the flesh and creating a convexity in this otherwise, this area that's otherwise generally a cavity between the pectoralis major and the deltoid on the outside. Okay, so those are kind of the landmarks up here, and the shaft of the humerus is more or less covered in muscle until you get down towards the elbow. And then what you start to see, hopefully, just observing from this point of view, you can see the roundness of the shaft of the humerus, and then at the base it starts to flare out and becomes actually very thin, right? So round, and then it thins out. This creates a bed for muscles to sit in, which we'll see when we talk about the arm muscles. But additionally, it flares out at either side and creates two bony protrusions called epicondyles. And these two epicondyles, you can feel them for yourself on your elbow, either side. The inside is called the medial epicondyle. The outside is called the lateral epicondyle. The inside bone is actually what's known as the funny bone because there's a nerve that runs right along the edge of it. So if you hit it, generally you impact the nerve onto the bone and it creates a very kind of funny sensation for whoever did it to you. Not funny for yourself generally. The outside one, the lateral epicondyle, is another nice landmark. And together, both of these, inside and outside, they create attachment points for the forearm muscles. And we'll talk about the complexity of that and the system that's developed when we get to those muscles. The other landmark that I want you guys to be familiar with at the elbow is the olecranon. which is the enlarged head of the ulna, right? So two bones in the forearm, the radius and the ulna, and together they do give us the ability to do this nice pronation and supination of the hand. And all of the rotation of the bone is happening in the radius up here at the elbow, with the ulna more or less fixed. So those two bones create the lower arm. But at the elbow, the ulna itself is actually very large, and we have the olecranon. And that's a critical bony landmark because together with the epicondyles, it creates, on a straight arm, a line of landmarks going straight across, and on a bent arm, it creates a nice triangle. Right, so changes shape, the elbow does, and actually lengthens a little bit when the arm is bent. Okay, another landmark is the ulnar furrow, which we trace down from the head of the ulna down to the styloid process of the ulna at the pinky side. Everybody's familiar with this, I think. You can feel it for yourself. It's right at the base of your pinky on the outside. So the pinky side is the ulnar side. The thumb side is the radial side. Okay, so this ulnar furrow is going to be important to us because it divides the flexor muscles on the bottom and the extensor muscles on the top. And you can also feel it under the skin, so it's always subcutaneous. Right? And on the other side, we can look at the radius really quick. Radius at the elbow is generally encased in muscle, so we don't really see it. But as it goes down to the wrist, it starts to get bigger, and it actually is a trade-off with the ulna shrinking. So at the elbow, the ulna is big, radius is small. At the wrist, the radius takes up the biggest block, and the ulna is just the small bump on the outside of the wrist. Okay, and that's all I'm going to say about the wrist, or the arm for right now. When we start to talk about the hands, we'll get into the carpals, and we'll get into the metacarpals, which are the main bones, and the phalanges, which are the actual finger digits. But for now, we'll leave that where it is. And I think that will be it for our introductory tour of the skeleton. And we're going to switch over to the slides now and have a look at some more points and review and look at it on photographs. Okay, thank you.